Knock, knock, knock.
Come in.
Hi.
Hello.
My name is Ashwati. I'm going to be your student nurse for the next few minutes. I'm just going to check your name and date of birth. Can you tell that to me?
Paige Turner,
Okay,
212.
perfect, Miss Turner. I'm going to close our curtain so that we have some privacy. Let me fold my hands there. Thank you. Do you have any allergies, Miss Turner, to the food, environment, any medications?
No allergies.
That's good. That matches the chart and your armband. Also, are you in any pain? 0 being no pain, 10 being the worst pain ever?
0.
Great. So Miss Ann here, Nurse Ann here is going to take over for me. I'm going to be going home, and I'm just going to give her a little bit of information about you. So we have Miss Turner. She was admitted 2 days ago while having a grand mal seizure. On admission, she was giving Nembutal to stop the seizure. She tolerated it well. She has a history of epilepsy and refractory seizures. There's been no cause found. She's been in the ER numerous times with the seizures. The family says that her seizure medication isn't helping. She's been taking benzodiazepines and anti-seizure medication in the past, and it hasn't helped.
Okay.
Her CT, her MRI, her fMRI are all without abnormal findings. The patient had a neurological exam this morning that came back normal.
Wonderful.
Her last vitals were her blood pressure was 132/82, her heart rate was 94 beats per minute, her respirations were 20 breaths per minute, normal depth, her temperature was 98.8, and oxygen sat was 100%. She's currently alert and oriented ×4. She's been without a seizure for the past 2 days. We're very happy about that. She's been started on myceline to see if it manages her seizures better than her previous medications.
Okay.
Doctor wanted to go with Soloftin, but he changed his mind after realizing we can only do that for 2 weeks.
Understand.
This might be better for her long-term management. She's tolerating it well, and there's no seizure activity, so we're hoping this works for her. She reports a little drowsiness. She's in good spirits. She's happy to be going home soon. The doctor, after monitoring her respirations, her EEG, is ready to discharge her, so she has discharge papers for 1,300 today.
Okay. I'm just going to check over here and check your respirations and your pulse, because the new medication that you're on can affect that. So, Miss Turner, your call light is right here. If you need anything, by all means, please let me know, and I will come in and assist you if you need to get out of the bed, because the medication that you are on does affect, causes dizziness. And then also I had one last question. How is your pain on a scale of 0 to 10?
0.
Wonderful. So happy to hear that. Okay, Miss Turner, your bed's down. If you need anything, you've got your call light, so please let me know. Thank you.
Oh, I'm so glad you feel a little better. Come in. Hi, ladies. How are you?
Hi, Miss Turner. How are you feeling?
Good.
Okay, wonderful. Well, my name is Student Nurse Ann, and I have great news. I got discharge papers from the doctor, so let's do some verification first. Miss Turner, can you state your name and age and birth date?
Paige Turner, 212.
Okay, wonderful. I'm gonna check all that with the system. Excellent. So again, I'm Nurse Ann, and you are?
I'm Ashley. I'm Miss Turner's sister.
Oh, wonderful. So nice to meet you. Well, she's doing really well, and I'm very happy to say that the doctor has said that she can go home. So I've got some.
Wow, do you hear that? We're going home.
So I've got some discharge papers
Okay.
that I'd like to go over. So very important. First things, I want to make sure you understand the new medication that you will continue to take when you go home. So we're right, yes, talking about the medication. Wonderful. And I'm so glad that your sister is here, since you are staying with her as she adapts to her new medication. Since we are not able to find the exact cause of her seizures, the doctor has prescribed a new class of anti-seizure medicine called barbiturates to see if it will help, since the typical benzodiazepine and anticonvulsants have not worked in the past. Okay.
Nurse, can you tell me a little bit more about seizures? I just don't know why this keeps happening to her. She tries so much medicine. The other nurse told us to sign these papers. I signed them.
Okay. So yes, I saw that you are allowed medical information for your sister. I've got that right here. She has epilepsy. which causes seizures. And I'm sure this is not new information to you. So seizures happen when there's a sudden disruption in the electrical function in the brain. Sometimes we're able to find a cause, and sometimes, unfortunately, we are not, like in your sister's case. The way you describe your seizures, Ms. Turner, this is called a tonic, when you go unconscious, and clonic, when your muscles jerk involuntarily, and it's a seizure. So these seizures are normally treated with anticonvulsants or benzodiazepine. Since you have not gotten the results that we are trying to achieve, we're going to try a new class of medication called barbiturates. And I know your uncontrolled seizures disrupt your life, and we want to fix that for you. And I know that's really important to you to get your life back to how it was. So that's important to us as well.
Oh, I hope this works this time.
Oh, I hope so too, I really do. So this new medicine is called mycin, and it's very important that you follow the directions on the medication. So for example, if you miss a dose, do not double dose. Don't stop taking your medicine without talking to your doctor first. If you do miss a dose, what can happen is you can have more seizures. You can also experience withdrawal symptoms, so it's very important that you stay regimented with your medication. Now when you take the medicine, understand that it can cause confusion, dizziness, drowsiness, headaches, it can cause irritability, hypotension, even side effects of nausea, vomiting, diarrhea, vertigo, and even a skin rash. So these are all normal side effects, unfortunately, but they tend to be normal with this medication. Now, this is why I'm glad that your sister is staying with you, Ms. Turner. This is so important for your safety. So another thing is don't drive because of the medication effects. Don't drive or do activities that require concentration until you know the effects are stable and you've been on this medication and it's controlling your seizures and the doctor feels you're ready and it's safe for you to drive. So please work with your PCP to get clearance to do these activities based on how you're doing after a few weeks, okay?
We'll set up that appointment as soon as we get home.
Wonderful. So also another thing I have to mention is that you cannot drink or shouldn't have alcohol while on this medication. Also don't start any new medications or herbs or natural remedies like kava kava and valerian without talking to your PCP. Medicines like sedative, hypnotics, depressants, opioids are very dangerous when taken with this medicine without doctor supervision. So it may cause you to stop breathing, can cause unconsciousness and addiction. So it's very important that you're continually talking with your PCP. It also, in your files, in your records, it states that you are not on any oral contraceptives. However, it is advised if you need to use contraceptives, a non-hormonal method would be best. But again, talk with your PCP. And if you do ever have any plans of getting pregnant, again, please notify your PCP. And then just want to touch on some emergency situations that you need to be aware of. So watch out for any impaired judgment, incoordination, sluggishness, speech disturbance, ataxia, hypoventilation, even a coma. So get medical attention immediately if any of these symptoms appear. Also, some adverse side effects to look at, to keep aware of, are angioedema, any fever, sore throat, mouth sores, unusual bleeding or bruising, nosebleeds, petechiae. Please contact your PCP immediately if you have any of these symptoms. And also make sure you have an updated medication identification card and you're carrying it with you at all times.
I think they gave that to us.
Okay, excellent. So try to get adequate rest, Ms. Turner. You can do things like sleeping in a dark room, quiet room, develop a bedtime ritual, limit your daytime napping, and avoid nicotine and caffeine, especially prior to bed. So there's also a risk for dependence on this drug. So if any changes in your mood, behavior, even suicidal ideations are experienced, please talk about it with your PCP as soon as possible. Okay, ladies, do you have any questions? I know it's been a lot that I've thrown at you, but it's all written down in your discharge papers.
Yes, I'm so glad you gave this to us. It explains everything. I'm gonna go home and make sure I read it again.
Wonderful. Okay, ladies, well, I think that's it. I will go ahead and finalize your papers. I'll be back here in a few minutes. Thank you.